General exercises and arm exercises are usually the first and often the only intervention provided to people after their breast cancer surgery. But this approach fails about 50% of people in their recovery. Are you ready to expand your business so that you can help breast cancer survivors in your community? You can help them with recovering their best arm movement. You can minimize pain at the chest and at the shoulder. And you can increase the softness of the tissue so that the lymphatics can flow as best they can. I've taken the key learning outcomes from the 2-day workshop that I've run over 2019 and 2018. And I've translated that into an online and live course. From the workshop experience, I've seen how important it is to get the hand palpation skills just right. I've seen how important it is to get that assessment just right so that the therapist can work out their treatment plan. And I've seen the absolute delight in the eyes of the volunteer patient and the therapist when they retest, that they see that there's been a gain in movement and an increase in the stretch of the skin or the soft tissues. But that's a workshop. And we know that in workshop experiences that we need to translate palpation skills by using words like soft or gentle or firm. Or what happens is that people usually run and to volunteer so that they're under the trainer's hands, or people or therapists crowd in around the table so that you can see exactly how the trainer is using their hands in the hands-on approach. So I had to work out how we translate this experience into online. And in fact, I think that we've achieved a better result. I've hooked up with Sarah Kamala from Mendology, who's the inventor of Standard Touch, which is this pressure-sensitive device. You will rent the device, you'll have it at the session, and I will give you instruction as to how that pressure is. So you have a digital readout, you have the device, and you'll be able to hit the exact target pressure for the assessment skills and the treatment skills. I've seen how quickly therapists can transition the skills we learn in the workshop into their practice with breast cancer survivors, especially when they're oncology massage therapists or lymphedema therapists. I absolutely believe with the 5-week training sessions and using Standard Touch as your training device to get the pressure right for the assessment and the treatment methods that we'll be going through, that you too will be able to transition these skills into your practice. I'm really excited and looking forward to the online live sessions. They start in October. Are you ready to expand your practice to breast cancer survivors in your community? If you are, join me.